Bismillahirrahmanirrahim. From A to Z News, I am Mr. Khan. Today I'm going to tell you something about the COVID-19. But first of all, I will tell what is COVID-19. COVID-19 is a severe acute respiratory syndrome. It is basically, for a layman, it is very important to understand that it is a respiratory illness. The symptoms for this disease is fever, tiredness, dry cough, itches and pain, nasal, that runny nose, and sour throat. So if you have these kind of symptoms, straight away run away to the hospital or where the test kits are present or available. Just go through with your test, and if you have a symptoms and if it is positive, don't take tension. Don't take tension. Just go and quarantine yourself for 14 days. You will be okay. Take it as a normal flu, because most of the people, it is like the bite of the snake. In 80% or 90% of the snakes, there's no poison, but because of the tension and because of the severity and the impression of that animal, people die. So it is the same thing. It is not a disease which will kill you. You have to take action. You need to be neat and clean and stay at your home. Stay home, stay safe. And if you have symptoms, just stay home for 14 days. This is what the COVID-19 is. And the news is that it is a sad news. A very famous microbiologist from London. He was actually from Zimbabwe, but he studied in London, and he was a very famous microbiologist. His name was Metwell. He died because of COVID-19. That microbiologist who studied deadly bacteria in public places dies. He was, working on such kind of viruses which was very normal, which was on the surfaces and everything, and he worked it out very well from the last 30-40 years, especially his work inside the metro stations, the tubes of London. He worked very hard, and he has produced a lot of vaccines and everything regarding viruses like COVID-19. So he was working on that, but at the age of 62 he was infected, and he got killed with this virus. So it is a sad news for the medical world, sad news for the whole world. But we pray for his soul, and definitely we pray for all doctors and all the scientists, all the microbiologists who are working on the same COVID-19 vaccines. So the people in the world, another news, the people in the world are experimenting different drugs, especially drugs targeting patients' immune system rather than the virus itself, could be the key to recovery for severe cases of the disease. And that is the expert microbiologist. They're working on the same formula. Those medicine, I'm telling again, those medicines who's going to affect the immune system of the body, so that kind of medicine will be given to the people who are in severe pain, or they have been severely affected by COVID-19, or their respiratory system is not working anymore. So these kind of drugs will only be applied to those patients who are serious. So this is the news, and let me just tell you what COVID-19 has affected the world and what is going to do. This COVID-19 pandemic is the defining global health crisis of our time, and the greatest challenge we have faced since World War II. I am telling you, this is the greatest challenge since World War II. Since its emergence in Asia late last year, the virus has spread to every continent except Antarctica. Cases are rising daily in Africa, Asia, United States of America, and Europe. Countries are racing to slow the spread of the virus by testing and treating patients, carrying out contact tracing, limiting their travel record, limiting travels, quarantining citizens, canceling large gatherings such as sporting events, concerts, schools, colleges, universities. The pandemic is moving like a wave, and it is a wave which you don't feel until and unless you are affected by this virus. It is a strange wave, but it is a wave, and it's spreading like anything, and one yet to cope, which seems very difficult. COVID 19 is much more than a health crisis. I will explain this. It is much more than a health crisis. By stressing every one of the countries it touches, it has the potential to create devastating social, economic, and political crisis that will leave deep scars. It means that it has already affected the economy, it is affecting the economy, and the people are still sleeping. They are not taking actions. What they actually do, they actually need some serious actions to fight this pandemic. Otherwise, the the pandemic, it will be just a disaster, and it will be very difficult to recover for decades. We need to wake up. We are definitely in uncharted territory. Many of our communities are now unrecognizable. Dozens of the world's greatest cities are deserted as people stay indoor, either by choice or by government order. Different lockdowns, government orders, smart lockdowns, city lockdowns, every lockdown is in process. That is the effect of this pandemic. Across the world, shops, theaters, restaurants, bars, everything is closed. Every day, people is losing jobs and income with no way of knowing when normality will return. Small island nations like Dubai, Abu Dhabi, Mauritius, Maldives, small nations which is dependent on tourism, have empty hotels and deserted beaches. So at the end, another news is that the International Labour Organization estimates that 195 million jobs could be lost, and it might be more than that. Can't it be alarming? Please wake up, because it's very, very important that we take some serious steps to cater this problem. Humanity needs leadership and solidarity to defend the coronavirus. I can only say this at the end. Rest, you people are mature, you understand. Do it until and unless this disaster might take us all. So let's fight this disaster and unite with each other. Thank you very much.